You're listening to the Veterinary Innovation Podcast.
You're listening to the Veterinary Innovation Podcast. My name is Shawn Wilkie, and along with my awesome co-host, we interview the innovators in this space every week. Super excited to get started today. Ivan, please go ahead and introduce today's guest.
Hey, I'm Zach. Very excited to introduce my colleague, Dr. Emmy Mohl. Dr. Emmy Mohl is a DVM and a Chief Medical Officer at Brief Media, home of clinicians Brief and Plums, and a practicing small animal veterinarian in Virginia. She brings nearly 15 years of experience to her role and is largely focused on finding solutions to make the clinical practice better for veterinarians everywhere. When she's not obsessing about the details of the Plum's user experience, Emmy can be found at home wrangling 2 elementary age children and 2 pandemic puppies. You did get those. So, did you get an air fryer as well?
No, but I bought a new house so that weren't on top of each other. So
Did it
I
come with
checked
an air
most of the
fryer?
pandemic boxes.
Amy, you definitely need to get an air fryer for your new house. We should have like a brand that we're promoting these air
Yeah, we
fryers.
should. Yeah, everybody should get a puppies and air fryer through pandemic. That's what I heard. But welcome to the show. Thank you for finding the time. Tell us all about what you're doing right now, because the topic that we chose is shifting clinical decision support to the point of care to support veterinarians, enhance patient care, and streamline client education. Tell us what you're excited about every day.
Absolutely. Well, thank you for having me here. I'm so excited to tell you about it. Point of care clinical decision support is something that our team, and when I say our, I work at Brief Media. We publish Plums and Clinicians Brief. We have a robust internal medical team. So we've got 8 or 10 veterinarians working on our team. And when our medical team sits down and thinks about how can we help our colleagues, how can we help the profession, what can we do to make our jobs better, something that we have been coming back to for years is supporting veterinarians in that moment of seeing patients and working up your cases. So that's where point of care support comes in. So we're not talking about you're looking at your patients and you need to learn something and you leave the exam room, go hunt for a textbook, or go post on an internet forum that you wait 24 hours to get a response. We're talking about, I need an answer right now. I don't need to sift through a million different pieces of information to find the one relevant clinical piece. That's really what point of care support is about. When we talk about clinical decision support, that's really a term that has been used for quite a while in the human healthcare field. Human physicians have several of these tools available that are updated, current information specifically designed to support those in the moment decisions. We really have not had that in the veterinary space that brings all of the different areas together that we need. So that's really what the Plums team is doing now, and what we're really excited about is taking that point of care support to the next level.
So what does that look like, Amy? Is that a piece of software? Is it an app on the iPhone? Is it a magazine? Help us understand for our Audible audience what it is that you guys are doing.
Absolutely. So for several years, we have had out there the Plums veterinary drugs. It's both a responsive website, so available on any mobile device, and both an iPhone and an Android app. So this new product that we're talking about that expands that point of care support is Plums Pro. It is also a fully responsive website. We actually have built it right on top of the existing Plums platform because we know that we've got a ton of veterinarians that are in Plums multiple times a day, every day. And to add additional tools in that same place where they're already going just saves time and smooths the workflow. So right now, Plums Pro is only available as that responsive website. We are looking to roll out access within the iOS app later this year, and Android probably to follow shortly after that.
So this is essentially to access the formulary, right? This is what we want to do, is to essentially provide everybody access to formulary without searching for that. Is it blue now? Is it blue book still? When I was
I
in school,
haven't seen a
no,
print
I think
book
it was
in
red after
several
that.
years,
Yeah,
so
that tells you how old I am. It's you can
Thanks
tell
for
by the
dating
color of the
yourself.
phone book.
I will date myself that the paper copy that I have is the maroon version, which is about 2007. So
That's one past me. Yeah, that's
yeah.
younger than me. So
So Plums, the digital version, Plums Veterinary Drugs, Our team cringes a little bit when we call it a formulary because it does include so much more information. But yes, so that's the product that's been out there for a long time. What's new and what's different is that we have thought about how else can we help veterinarians. So that's all the drug information that we need. This new product, Plums Pro, we are offering all of that drug information. And we've also built out all new original content around diagnostic and treatment information for clinical conditions, and a huge library of pet owner education handouts that you can dispense right from inside the website. So you can email them, you can print them. The idea is that when you're going in, you can go from the start to the finish of a case. You can find the drug information that you need. You can check your drug interactions. You can provide client information about that drug. You can go to your diagnosis and get diagnostic information, treatment information, monitoring, all of that clinically relevant information all in one place.
Really, really cool. I have a interesting story about Plum from vet school. So when you're in school, you're not really taught drugs. Like you're more talking about the generic and basically the drugs, not really real life application of them. So for the most part, and I don't know if it changed, but for the most part, I feel like most veterinarians graduate with a knowledge of what class of drugs or their generic name. But then you really need Plum to kind of understand like all the drugs that are in that class, especially in your clinic. They could be different brand names. So I think that the knowledge that you graduate with is very academic rather than practical. And there was one tip that our professor of pharmacology gave all of us. He said that in order to learn all the medications, replace whatever literature, and we didn't have Facebook and phones, I think, at that point, in the bathroom with Plum. And every time you go to the bathroom, instead of reading anything else, read one or two drugs. And I personally read Plum 3 times throughout the vet school using that method. But I think this is brilliant that now we can access it that way. I'm going to ask sort of, a little bit provocative question to you about the other maybe competitors to you and how is it different? And this is sort of a softball for you as well. But isn't 5 minute consult or veterinary advisory there's sort of similar now? Because are you in the same playing field, or is it, how are you different? And if someone is thinking, okay, I should get that, because I'm immediately thinking, I did not know that you have the client information sheets, which is very interesting to me, and also all this sort of the diagnostics and stuff. So how is it different, and why would one choose your product versus those other ones?
Absolutely. So you probably don't know about it because it's only been live and out in the world for a little less than a month. So we launched in December with the Pro product. The reason it's different is because it is built right in with that Plums platform. So people who are using Plums are already there in the digital format. They're already there. Our research shows multiple times a day, every day that they work a shift. So the biggest thing with introducing a new tool is the behavior change to use the tool. We all know we get set in our ways, and I still reach for some of my textbooks that I've been reaching for quite a while. So the behavior change and the ability to use that new resource is so much easier when it's in a location where you're already going all the time. The other difference is the content. This content is really, like I said, it's all new. It's created by our team. It's also more robust than some of the textbook-based resources out there because we have the ability to fit more in. And it's updated. So we'll be regularly updating this content just like we do with the drug monographs. They'll be reviewed and updated as new information comes out.
So one thing that caught my attention as well, just based on what I'm doing now with Galaxy Vets, which is a new group, that's myself a shameless promotion. But so for something like that, so we're looking at solutions at scale for we're going to have sort of centralized PIMS, we're going to have disparate PIMS, and then, but I am looking for a solution to have sort of unified approach to have access. We have the telemedicine service that we're building out, teletriage, we're building out the physical location. So it's the entire sort of healthcare system, as we call it. Is there an API? Can you integrate with this stuff? Can you plug? I know that I don't want to be mistaken here, but I think that Instinct has integration with Plum. Is there access from technology point of view of other practice management systems, or even if someone would build something inside of their organization? Can you tap into API and have it more available through that? Or is it a standalone product and you just have to use it separately?
So right now, we are early in the process and the road mapping of how and when we're going to offer APIs. We absolutely are planning to offer integrations both with PIM software, and we have some enterprise solutions that we're looking at as well. So all of those things are possible. I can't flip the switch and turn them on quite yet, but we are definitely having those conversations, working with our technology team and figuring out how and when we can offer those kinds of solutions.
Amy, a couple questions for you. One is, how long has your team been working on this? What kind of work lift is represented behind the new Plums Pro?
So it's huge. It's a project that we have been thinking around and planning for about 5 years. We started creating content, and that's been the biggest lift is creating the content
Yeah,
that's
that's the
included
hardest.
in there.
Yeah.
We're about 3 years in. I would say 40% of the content is complete, and we are adding more every single day.
Wow.
And it depends a little bit on the content type, how much is there, how big the library is, how fast we're adding, because we've got 4 or 5 different content types involved. But we're adding every day. We have a huge group of amazing expert authors in the profession who are writing this content. Like I said, it's all new. We're not repurposing or incorporating content from anywhere else. It's all created specifically for this purpose.
One of the other things that I can't help but think is when you hear the word pro, it represents a cost. What is the cost for the product and how do you license it?
It is a premium product. As veterinarians, we know that we tend to raise our eyebrow at a price sometimes. So we are trying to phrase this in a way that, looking at everything that you get. So it is a monthly subscription. For an individual to purchase it, it's $79 per month. As we look at bigger groups, practices, enterprise solutions, obviously our team works through that, but the sort of base price is $79 per user per month.
Makes sense. So yeah, if I'm just talking about the deploying it at scale, it will be interesting to see what you come up with the enterprise solutions too. Because a lot of products, one thing that I learned through SmartFlow years, and then it was very interesting. My sort of mindset towards how we build software in the veterinary world, been put through this sort of prism of first selling to clinicians. And SmartFlow, it was sold to veterinarians, and almost every presentation ended up in a sale. And it was so, it was so rewarding to see what you came up with. People totally get it and they buy it. And then when we moved to working with the enterprise and consolidators, they were not interested. And I was like, how are you not interested if all your vets are interested? So it's a completely different sort of mindset there, because corporate, they're interested in return on investment and money, essentially. I mean, they might say that they're interested in pet care and stuff like that, but at the end of the day, they're responsible for return on investment of their shareholders. So it's interesting if you thought about the proposition to those, and maybe I'm catching you off guard, but then how would they generate return on investment to potentially tap into it and talk to you about enterprise solution for the whole organization?
So this tool is absolutely developed to support the individual veterinarian make their day better. In doing that, we're increasing efficiency. We're saving time. We're absolutely saving time from people running around looking for different resources. We are focusing a lot of the research in one place. When we're saving time and increasing efficiency, we're allowing people to take their breaks, take their lunch, or see more appointments, depending on the culture of your practice. So we're focusing on it as an efficiency tool for sure. We're also really looking at this as a retention tool. We know staffing is crazy these days, and trying to hire and retain people is challenging. As a veterinarian using this in practice, and I have been using this in practice since we launched our beta test over a year ago, knowing that I have the support and the backup easily accessible when I have a question is really helpful. And especially for some of the younger grads or people who are changing careers, coming over from equine into small animal, or have taken a break to be with their families and are coming back and feeling a little rusty, having the support to know that you can just quick check something and confirm what you're doing, make sure you haven't missed a differential, validate your next steps, really helps with confidence. And we know there are plenty of veterinarians that are struggling with confidence, struggling with imposter syndrome. I know you have a focus on burnout, talking about burnout and some of the things that come up. If we can make any piece of that easier, make someone feel more confident in what they're doing, that I think that helps as a retention strategy as well. So those are some of the things we're talking about with corporates, in addition to the benefits to the individual doctor.
Yeah, makes perfect sense. So, Amy, guide us through a day in the life. You've got this new tool. It's exciting. Just kind of help illustrate, where you found it the most useful as one of the early beta users of the tool, so that our, audience of veterinary professionals can kind of understand just even a little bit more than the high level we've talked about so far.
So I have a definite bias for this question coming into this question. My sort of favorite piece and biggest pain point in my daily practice is the pet owner education piece. So that has been my primary focus in my work on the content. And that is the piece that I use all the time and I cannot live without at this point. So for example, my last shift in the clinic, we're still curbside. So I'm out in the parking lot talking to the pet owner. It's a first annual for a puppy that has not been on any preventives. So I've already talked to them about preventives, emailed from the parking lot this pet owner information about heartworm prevention, flea and tick prevention. I'm checking them out, and my staff comes out to tell me, this puppy just came up Lyme positive. What do you want to do? From, again, still in the parking lot. From there, I can pull up information about Lyme disease. I can pull up information about what we want to do as far as monitoring and send it all to the pet owner right there from my phone. So I don't have to run back inside. I don't have to, go and print, find it, and bring it back to them. I emailed everything. And then I can also share with the other doctors in my practice, this is the information that I've given to this pet owner. And it allows us to be more consistent across the practice as far as the information we're giving, how we share. Our staff can go in and print any of these handouts or email any of them and share them. And it saves so much time. I was previously, handwriting or typing on the bottom of the receipt information. And now I know I have these. Most of them are about 2-page question and answer format in simple language information about the things that I talk about with pet owners every day.
That's awesome.
Really cool. And then, so in terms of content itself, is that mostly written content? It's just that, today people are lazy reading. Is there any vision in the sort of little video format?
There are, yep. So in what we call clinical briefs, which are the diagnostic and treatment monographs, they're very similar to drug monographs in how they're set up. Those are each written by a boarded expert in their area, and they are able to supply images, video, any other media that makes sense for the topic. So we do have images fully integrated. We do have some videos included.
Oh, so there's like links embedded and they can open it on their devices.
Yeah, it's actually an overlay, so you don't have to leave the information that you're in. It opens up on top. You can view it, maximize it, whatever you need to do, and then hide it again. So it's
Really cool.
all right there in the content.
That's awesome, Amy. If you have any links that we can include in the show notes, it'd be super cool for people to kind of get some more information, since it's all about the content. We'd love to do that.
Yeah, absolutely. We've got a great demo video online at plums.com that I'll share with you.
That's awesome. Well, listen, we ran through the time like we do every single episode. We like to end the episodes the same way every time. So the first question we got for you is a inspiring book, whether it's fiction, nonfiction, a TED Talk, a YouTube video, something that you found inspiring or cool that you've consumed lately.
I don't know that I'd call it inspiring, but I would say this book has really helped us accomplish what we have with Plums. The book Traction by Gino Wickman. So we implemented the Traction system right around the time we were starting to build Plums Pro. And it's really amazing to look back over the last few years and see what we've accomplished with a really small team that's growing like crazy and keeping things moving. Traction is all about accountability and working in 90-day goals. And it has made a huge difference for our team in getting this product out into the world.
We should start getting commission on that.
We won't disagree. We both use Traction inside our
Oh, so
organization.
you know all about it then.
And Sean's CFO hated it when I proposed implementing it, but I don't
We
think
had
he-
some wrinkles early on too, but most of us are fully converted now.
I love how you said it's not inspiring. It's pretty dry and hard to read and hard
It's
to understand.
not the most engaging book, but the principles are really great.
I was inspired. First time I read it, it saved my life in SmartFlow. I just had this feeling when the wheels were coming off and I couldn't understand what's next to do. And I feel like it's usually about 35 plus people when you just lose control. You can't, anyway, we're all for it. That's like 6th or 7th company where I implemented Traction.
And probably the
Cool.
6th or 7th guest that has recommended it on our show. So
Probably
if you haven't seen it, go check it out.
Yeah, Traction by Gino Wickman. And the other thing that we usually ask is their guests that you would recommend inviting to this show.
Yeah, so my colleague, Dr. Jordy Waller, she works with us at Brief. She works exclusively on our drug interaction checker. And if we're talking about innovation and what we're doing with content and technology, we didn't have a chance to talk about that at all today, but it's really fascinating what she's doing with the content and getting that drug interaction checker out there. So she would be a really interesting guest to talk to.
Thank you so much for listening to the Veterinary Innovation Podcast. If you want to hear about our new episodes, please follow us on any social media channel. Also, you can check out our website at veterinaryin.podcast.com. See you next week.